Welcome to episode 5 of Triangle Dentistry Talk. I'm your host, Dr. Carl Bernstein. I have an office in Cary, North Carolina, Bernstein Orthodontics, and I'm here with the amazing Dr. Jeff Casebier, the owner of General Dentistry office in Cary. It's called Cary Implant and General Dentistry. How are you today?
Oh, the amazing Dr. Jeff Casebier.
Oh,
That's nice
yes,
of you.
yes. Have you
I'm
had
great.
time to
I'm
spend
good.
any
That's a
time with
nobody
Dr.
gets to tell me
Casebier?
that
You
that
need to spend.
I need to do more intros with you before I walk into the operatory. The amazing Dr. Casebier. No, that's kind of you. I'm
Exactly,
good.
exactly.
I'm good, man. How you doing?
I'm doing great. Thank you for asking.
Cool.
I treat a lot of kids and see a lot of kids, so we always want those big motivational words, and you deserve it as
Yeah.
well. But let's uh
Thanks, man.
let's just kind of start off with a little bit about yourself. Where are you from originally? I just heard where you were from. It shocked me, but go ahead, tell everyone.
Hawaii, yeah. So I was born and raised in Hawaii. I lived there. My whole family was there. I was there till I was 18. Moved away to Oregon, and then I was there for about 17 years. So I spent my time in Oregon just at a small liberal arts college. Went straight to OHSU Dental School in Portland, and then just lived and worked there for 17 years. And it was great. I love being in the Pacific Northwest. Learned a lot. Traveled a little bit, but uh, yeah, born and raised in Hawaii. It's kind of great. You grow up in a false sense of security when you live in Hawaii. The beach is right there and it's sunny, and you assume this is all normal and natural. Then you move away and everyone talks about how amazing Hawaii is. And you're like, yeah, it's fine, it's home. But then you realize, yeah, it really was amazing. God, this is a great place to be. So I got lucky. Yeah, being from Hawaii is pretty great.
Now,
Mhm.
one thing, I've never been to Hawaii, a little far, always being more from Midwest, East Coast more
Mhm.
so. It's a far trip, but do you surf?
Yeah,
How many times, are you, obviously I
that's the
probably couldn't
first
do
time I've been
that,
asked that question. I'm kidding.
right? That's always the
Uh,
first, do you surf?
yeah. Yeah, so I do. Yeah, I did when I was growing up. And then I moved to Oregon, and the water there is about 55 degrees, and I surfed one
Yes.
time, and that was it. So I haven't surfed 17 years. Now that I'm in North Carolina, though, warm water, so I might
I
try again. It's
Yeah,
been a while, so
I have heard there is
mhm.
surfing in North Carolina, but I
I
have never
know.
gone. I don't think it's the same waves you're going to get in Hawaii. Let's just say
I
that.
don't expect it. No,
Yeah,
I wasn't a,
take it
big
easy, right?
wave
We're getting
surfer on the
older.
video. Yeah, exactly. Yeah, I need the small little waves. That's perfect for me. So
Yes.
I may give it a try. Yeah, get back on that horse.
I kind of learned from where you're from, but what about any family, married, kids?
So, yep, wife of 7 years now, two kids, two daughters, 4-year-old and a 1-year-old. And yeah, family wise, I mean, like I said, my family was from Hawaii. I met my wife in Oregon. Um, and that was going to be kind of our home. And, about a little under a year ago, we decided to move on out to North Carolina because her whole family moved out here too. Her sister, her sister's husband, their kids, her mother, her father, everyone was in North Carolina. We were all the way in Oregon, and so we figured we wanted our family to be around family. We wanted that tribe. And I went out to visit and went to Cary, and it was perfect. I mean, it's amazing weather, great place for kids, a lot to do. The mountains and the coast are right there. We lucked out. It's such a great place to be. So Oregon was great. I loved it, but I'm finding my new home in Cary. So it's so nice out here, and I'm so happy to be out here with my family, and being around everyone's so nice too. Growing up with
Exactly. Yeah, that
grandma and
definitely
grandpa
being
next
close to
door is really
family.
cool.
Yeah, that's
Yeah,
nice. And
it's
then,
it's
I
very
always call
nice.
Cary, Cary and Raleigh area kind of like the big suburb. It's got everything, but it
Yeah,
always feels kind of like a suburb no matter where you go, even downtown.
yeah,
Um, Raleigh
that's
is
fair.
pretty small for me. um,
It is
you know,
kind of yeah, yeah.
now we kind of learned a little bit about yourself. You just started at this office, but you've been practicing dentistry for how many years now?
I've been practicing for about 11 years now. So I graduated in 2013. I've done a fellowship with California Implant Institute. I've done a lot of continuing education and gotten a fellowship in the AGD. And so spent a lot of my time, the first half of my career so far was in public health dentistry, which was great being able to give back and see people in need and really experience a lot of the clinical side, but also just to build that empathy and connection with patients. That's really why I got into it in the first place. Um, so yeah, I've been practicing for 11 years. And when I moved out here, I met the docs over at the practice I'm working at now, and we all get along so well. Our philosophy is very similar minded. It's a very close knit family practice, and it's just perfect. So it's a great transition. Mhm.
Yeah, that it is. And, Cary Implant and General Dentistry is a great office. So, obviously, if any of you listeners out there, give it a chance. If you don't have a dental home or looking for a new dental home, give the office a chance. There are other doctors there as well for now. Things, could change in the future, may not. You just never know with any office. And as everyone gets older, but Dr. Casebier is obviously there, and he's an amazing dentist as well. So give it a chance
Mhm.
if you are looking for a home. But what makes your dental office unique? What makes it special? Because there's always that little bit. Sometimes the doctor gives its own specialty in the sense of the
Mhm.
atmosphere or the environment. But going into their office, it really does feel homey. But what makes your office so special, and why do people love it so much?
That's a great question. And it's multifaceted. There's a lot of every dental offices want to be a certain way to attract to the families to provide services. I think what attracted me the most to this area, these doctors, my team, is the that sense of home, that sense of comfort. When I worked in Oregon, I was the owner of a practice in a small town. It was about 3,000 people in that town. I lived in about a mile and a half away, and everybody knew everybody. It was a family practice, you know. It was great. You got to do really individual one-on-one care. It was very specialized. We did a lot of services in-house. We tried to do a lot of what we could for our patients because we were the only ones within 15 miles of a dentist. And
Right.
so we were doing everything we could for our patients, and they loved that. When I came here to North Carolina and I got with the other doctors, talked to my team, I noticed our patients, I noticed the doctors, and even the town of Cary, very similar to a small town I was at. And that's
Hmm.
what I loved about this practice was that you come in and, we do everything we can for you and really do try and treat you like family. There's been patients that have been at this practice for 35 years. Our team members have been here for some 15, 20, 25 years. And it's great. We've developed such close knit relationships with patients and families that you get to see them grow up through the generations. I saw that in Oregon as well too. And I just thought like that's a great environment to cultivate. That's kind of what I want to be a steward of, this place where people can come and feel safe, heard, trusted, um, and get their dental care all under one roof. So kind of like a home. So that's the main thing I think that sets apart our office from others is we really try and bring that sense of home, family, um, connection. So I don't know.
You know,
I love that part of it. Mm.
Yeah, and then one thing that always definitely makes an office feel like home is the staff. Brag a little bit about your
Hmm.
staff. I've been to their office a few times. Our offices are not too far apart from each other, and I've gone and
Hmm.
said hi to Dr. Casebier at times, and some of the other doctors that are there. And the staff is awesome. Always makes you feel welcome right when you walk in the door. And
That's
they
sweet.
don't know
Hmm.
my name too much because I don't come around too many times. But if you're there frequently, they definitely always were saying patients' names and introducing
Yeah.
themselves. And so
Hmm.
brag a little bit about your staff because they are awesome.
They are. I know. I'm very lucky to be working with these fine people. I mean, they some of them, like I said, have been here 15, 20 years and developed those relationships with patients. But just like from the minute you walk in, even if you're a new patient or someone that we've been seeing for 15 years, Abby and Carolyn up front are just very outgoing and personal, and they're very warm and non-judgmental. Right up front, we make sure you're taken care of. Everything is in a line before you come back, and then when you're in the back, we're the same way. Rose and Dawn and Mary, everyone in the back office, all very sweet, very calm, very personable, and very fun and I mean, there's laughter going up and down the halls. There's a couple of our hygienists that have some pretty loud laughs, so we can kind of hear that going down the hall. So we're like, okay, so they're having a good time there. This is good.
Yeah, good. That's
But
what you
we're
want to
always,
hear. Because
we're joking with each other. I know you're joking with each other. We're joking with the patients. We're making them feel comfortable and just relax. Because when you come to a dental office, no one is completely relaxed.
Exactly.
No one is just feeling like I'm just going to go to the spa. So my team is so great at making people feel at home and at ease, and they're really fun to work with, and yeah, they're my home away from home.
Yeah,
So
that's
it's really
great.
cool.
And exactly what you had mentioned. No one, at least I haven't met too many people that go to the dentist for fun. It's always kind of a scary experience. You're always kind
Ye-
of waiting for some pain to happen. Even
Yeah,
me, when I go to the dentist, and my dentist is my mom, so that you shouldn't be
I
scared.
didn't know that. Oh,
Yeah, so but it's the dental office. You're always nervous. You can't see what's happening inside your mouth, and you don't know what to expect. So when the environment is fun, the atmosphere is
hmm
relaxed, you're always going to feel a little bit
hmm
better, and it's going to make you
hmm
want to take care of your teeth, which is the most important part, and which is why we're here today. And so
yeah.
we've gotten to know a little bit about Dr. Casebier and Carrie Implant and General Dentistry, but let's know a little bit about what they do at the office. They are a general dentist. They have, he's got a ton of experience. The other doctors there have maybe a little bit more experience just by age, but he's Dr. Casebier is a lifelong learner. I mean, if you've heard it a little bit, he's always doing
Mhm.
CE, which is continuing education, always learning new techniques. But what is it, that is done at a general dentist office in case someone doesn't know about what you guys do?
Yeah, and yeah, I think speaking on that experience aspect, I mean, between the doctors here, we've got, I think it's close to over 80 or 90 years of experience.
I was going to say
There's
it's
just
got to be
so
close
much.
to 100 years. I mean,
It's up
it's
there.
got to
I
be
mean,
close.
there's so much knowledge in this office, and it's so great being a part of that as a patient, having that much uh, having that much security in the sense that, okay, there's enough knowledge, enough uh, updated technology that you can be well taken care of throughout your whole visit. And so a general dentist would be the one to really look at what your goals are for your teeth, your smile. You know, a lot of people think I'll come to the dentist if something hurts or
Hmm.
something doesn't hurt right away, so it's not a problem, which may be true, but a lot of the times they're never really asked what they want. And one of the things I really want to make it a point of in my office as a general dentist is to see what are your goals? Where do you want to be 5, 10, 15, 20 years? With your teeth, with your health, it's all related. A lot of it starts in the mouth. And so the general dentist is the one to take the helm of that ship and steer it in the direction that you want to go to. If you want this type of smile, if you want this fixed, if you're not happy with something, or if we see something, we're here to talk about all those issues and make sure that any problems or any needs are addressed because um, that's the one of the reasons I got into dentistry too, is just that empathy aspect of like helping people and making sure they can get where they want to go. And you can do so much of that in dentistry. So the general dentist helps oversee that. A lot of the times it's some specialty services. I may need a crown or even an implant. I may need a root canal. And a lot of the times we have to work with other doctors. One of the really nice things about our office is that we try and do all of that here. So whether it's you need a root canal or a crown or a specialty procedure, maybe even like uh, something surgery based or something orthodontic based. I mean, when it gets to the tricky stuff that or the things where we're unsure of, this is where I tag you in, and it's great working with you to bounce off cases. And we do a lot of what we can here, just so the patient can think that they're well taken care of in one spot. Nobody really wants to see 5 or 6 different dentists. They want to kind of be taken care of by someone who knows and can manage where they want to go. And it's great working with providers like you because you're very personable and you relate to people so well. And when we send our patients over there, they always come back happy and like raving.
Well,
And
that's how
so
we
it's
like
like,
to try
this
to
is a
do. We like
good,
to
I
hear
love that
that.
relationship. Yeah. So that's what we're trying to cultivate. And so if we're the ones managing that ship, quarterbacking it, then it's exciting to take people on that journey.
Exactly.
Yeah.
And we're very blessed in the Cary, Raleigh area, Apex,
hmm
whatever city you're officially in. We do have a
Yeah.
lot of dentists and we have a lot of specialists around here, and it's great. We don't want to put anyone else down. Everyone's wonderful here. We have a lot of choices to meet everyone's need. But one thing
Yeah.
that you see here with Dr. Casebier is, obviously they're able to help you with a lot of your issues, but also, at the same time, they understand, when they need to bring in, someone else, and they have that team member or someone outside of the office. They have a team that is able to help them help their patients achieve that goal.
Hmm.
Our goals as dentists, we'd love if everyone had perfect health and we didn't have to do any dental work, but I think as Dr. Case
Yeah.
Beer had said, sometimes we don't have any pain, but at the same time, it doesn't mean everything is perfectly healthy. So that's why definitely having a general dentist, normally, and he'll, give more information on that, but traditionally you see some go to your dentist about twice a year at a, hopefully a minimum, and sometimes
Mm.
more. But really the goal is not to try to find something, it's to help alleviate if there is an issue. Um, what do you think, Dr. Case Beer?
Yeah, yeah, we're never going and looking for trouble, you know. Like I said, it's all about having that conversation. And so it always starts with those questions, you know, of what are your goals? Where do you see yourself in 5 or 10 years? You know, if you could change something about your smile, what would it be? And that's not always a cosmetic thing. A lot of the times people will look in the mirror and they'll say, I don't really like this about my smile, or I'm not really happy about this, but you know, it's not hurting me, no big deal. Well, if it's on your mind, if you want to change it, then let's talk about that. You know, talk about how it can get done. And we work with, you know, our orthodontist or someone else to get that to the right area of where you want to be. So it's totally true. I mean, we do have people that come in that have some problems, some dental issues, some dental pain, and that's, you know, that's definitely what we do here. If you've got dental pain, even acute pain, we're here for you, even if we've never seen you before. Um,
Yep.
but a lot of it is that comprehensive care, is trying to make sure that we can not only take care of all the disease, the bacteria, the cavities, the any inflammation or infection, but also to get things functioning and looking, you know, good decades from now, and then maintaining that. So the body, the oral cavity is so connected to the rest of the body that it's just it's such a great place to start that conversation. And sometimes it opens it up into other things like medications, diet, just becomes a whole body health problem or issue. And I think that's really cool.
Yeah, I mean, I think you're definitely right there, in that a lot of people they kind of put the mouth and oral health sometimes on the back burner, and we get it, there's always
Hmm.
sometimes something that could be more important. Obviously, as dentists, we're biased. We think the mouth
Yeah.
is should be top on the list there, but we understand there's other things that are also important in life, and you got to take care of. But I think
Oh yeah.
what you're seeing here is how relaxed, and comfortable Dr. K Spear is, and good at explaining the treatment, that you're going to get good care there. You're going to feel really comfortable there. You're going to feel comfortable in the treatment plan that he provides you, which is sometimes uh, some of the biggest fears. People are nervous to go to the dentist because they're so worried that they're going to have so many problems when you may not, but you may be able to catch
Yeah.
something early when it's smaller. We always try to inform our patients and say, don't go when you're having pain, because then you're going to probably
Hmm.
have a much bigger issue than if you went maybe a year or two ago. So
Yeah.
Dr. Case Beer is always available. I think you guys are open Monday through Friday, is that correct?
Monday through Friday. Yeah, and our answering machine has our cell phones on it. So if there's ever a problem, if there's ever an issue, I mean, there's a direct line to one of us. And like I said, there's over 100 years of experience with us too. There's lots of us here, so we can make sure that someone's available for you. Um, yeah, it's tricky making sure that people feel comfortable here. You know, I always say the hardest part about the dentist is just showing up. You know, 95%, 98% of the difficult part is just showing up. After that, it's really all downhill. But you know, if we can get that momentum to show up and just and take that step, and it just it says a lot about where you want to go and what you want to do with your oral health. So yeah, I'm always impressed when people just show up, you know? I mean, that's a lot.
And one thing that obviously people are sometimes nervous about is multiple appointments. To get one, you go
Hmm.
for one appointment, hoping to get most things done. Maybe cavities or crowns, and you don't have time either. Family, kids, work. What is that new
Hmm.
technology that you guys have at your office that is able to deliver those products and deliver those treatment and aesthetic outcomes the same day?
Yeah. It's great. It's great working in an office like this because me being new to the area, one of the things I really value is continuing education, keeping up with current literature, current technologies, and the doctors here, some have been practicing for 20 years, some 35 years. They're all the basically constant learners. They're all wanting to keep up on that technology and make sure that we're at the forefront of what we're doing and why we're doing it. So they had already invested quite a bit in digital dentistry and making the patient experience better through digital dentistry, making those same day appointments through digital dentistry, and just keeping up on literature so that we're doing the minimal amount of work in the best or quickest way possible. So some of that stuff is digital scanning. Before you were getting goopy impressions, very claustrophobic, very messy. No
Oh
one,
yeah,
no one really
make you
liked
feel
it.
like you're
I've never
choking.
heard someone saying, "I can't wait for that big tray of goopy stuff to go in my mouth," and it's terrible. I mean, so we've incorporated digital scanners into every operatory. We can digitally scan your teeth with a little wand that sends it straight to our laboratory. We have an in-house milling unit, which means the crowns, which we originally, a decade ago, had to send out to a laboratory and have you have a temporary and then come back a second time. We do them all the same day. So if there was an instance where a tooth broke or you did need some sort of full protection or a crown, we could get you in. We can do the crown preparation, seat the crown, send you out the door. You're done. I mean, we love seeing our patients, but no one really loves coming to the dentist multiple times.
Exactly.
Um,
And
and
just
then,
before you continue on,
yeah.
how long does a crown, like if you were going to get an in-house crown, and
hmm
maybe you need to do that, how long does that appointment normally take for patients?
Yeah, that's a good question. With the technology we have, how efficient we become with it with our team, it's a pretty quick appointment. I mean, you're in and out of the chair in under 2 hours. And a lot of that time is waiting for the work. We get things comfortable, we do what we need to do. You can go and out to the store if you need to while the crown's being milled. You can hang out, read a book, listen to a podcast, and then after that waiting period, we cement the crown, we see in your way. So under 2 hours. Even if it's something like needing a root canal done and needing a crown done, still around the same amount of time. So I think a lot of people come into it thinking, oh my gosh, this is going to take forever. I'm going to be in the
Exactly.
chair for so long. In actuality, you're in the chair for 5 or 10 minutes, actually have the work done. And then a lot of it is just making sure we get it done right. And that's what the technology is for. I mean, we have the digital scanners, we have the 3D X-ray technology, which allows us to really diagnose properly to make sure we're diagnosing correctly, and we're doing it in the right manner. We never want to jump to conclusions on something. It's always I'm a woodworker, and I like working and shaping and polishing, and I love the measure twice, cut once.
Yep.
In dentistry,
Yep.
it's like measure 5 times, cut once. And so this technology allows us to do that in a real efficient way in a shorter period of time. It's awesome. And it's always evolving too. It's very, very cool stuff. Yeah.
And that's with every industry, dentistry is evolving just as much as the tech industry, and we keep
hmm
getting more new technology. That is
Yeah.
the goal. Obviously, is to make treatment outcomes quicker, but also to make things more
hmm
comfortable for the patient. And if that's efficiency, everyone wants to be efficient. Everyone wants to get done right away. And especially more in today's time, we want it done as soon as possible. We're all busy. We all have a lot of things to deal with,
Yeah.
and like we had kind of talked
Yeah.
about, a lot of times oral health and sometimes teeth, get put a little bit on the back burner. But if you can get it done in one day, maybe that'll motivate you, to just get it, get into the
Yeah.
appointment and get in with carie implant and general dentistry and get those
Yeah.
problems or a beautiful smile that you've always wanted. Come on in. They're always ready to take new people on, and I'm telling you, you guys will be so happy if you give them a chance and to go there. Um, we're kind of getting to the end. Is there anything that you feel like maybe I missed that you think people would want to know about?
Oh boy, let's see. Um,
And not to put you on the spot, if we're hitting it, most of the
I
information, we're doing great. That's what we wanted to.
know. Let's see. I would say, yeah, like you said, we're always looking for new patients, new clients. Uh, being in the town of Cary, we're looking at joining certain events and clubs, and so you may see us at a local fundraiser event or a local event, kind of getting our name out there, letting people know we're out here as well too. Um, and I would say if you're at all curious, even if it's uh, implants, if it's I might need this, if I what are veneers, what is a crown, give us a call. I mean, I have my cell phone readily accessible to our patients. If they have any questions at all, questions, bad one, I love just starting that conversation. If you're interested, I mean, you can already tell I'm a nerd about this stuff. I really like talking about it. And if you're interested, I'd love to try to explain it to you, what we could do to help you, and just make sure that it's not pressured. I don't ever want someone to feel like we're judging them, we're
Exactly.
pressuring them into something. And it all starts with just open up that conversation. So, I mean, yeah, I'd say nothing else to really plug. I mean, you've been so nice plugging this already. Uh, just a matter of if you're interested, let us know, give us a call, come on by, say hi. Um, the girls probably always have some type of cookie they've baked or pie or for a dental office, we have quite a few sweets,
I know
which
that
is
seems like too
not
common for dental
the best
offices.
thing.
We're trying to keep our
It's
business
just like,
low.
and what's great, oh man, yeah, and it's not store-bought Harris Teeter cookies. Our hygienist Paula makes amazing pies and cookies, and every day there's something else here. So you'll probably get a cookie if you come in. I don't know. There's always something going on. So it's a cool place to be. Yeah, and we just love meeting new people and inviting people in. Hmm.
Well, it was great to have you on the Triangle Dentistry Talk podcast, Dr. Jeff Casebier, and again, this was Dr. Jeff Casebier with Carey Implant and General Dentistry. Not to where exactly are you guys located? How about that? We didn't even mention that.
Yeah, we are right off Cary Parkway, 100 Ridgeview Drive, so sort of near the Trader Joe's of Cary Parkway. Right, a little off the beaten path, but near Triangle Pediatrics, similar area too. Big
Exactly.
building,
Yes.
kind of located in a middle of a foresty tree area, so it's a really beautiful place to be. I don't know, yeah, that was the thing I loved about Cary too, is just the green out here.
Oh yeah.
Coming from Oregon, it's so green, and then coming back to Cary, it's also so green. I'm like, man, I lucked out. This is great.
The one better thing though is you don't have as much rain, so that's you can be outside
Oh my
without
gosh,
needing an
that is the
umbrella.
one. Oof. Yeah, going or is pretty. It's beautiful, but it's pretty rough. You get 10 months of rain and 2 months of sunshine, and here it's the reverse. I haven't been the summers here yet, and everyone keeps telling me to watch out. So I'm from Hawaii, so I can handle the
I
humidity,
was gonna
but
say I
we'll
think you're
see how
gonna
that
be
goes.
just fine. You're gonna
I
enjoy it.
I feel yeah, I've been down that road before. Yeah,
Well, it was a
yeah.
pleasure having you on today, Dr. Case Beer, and
Thank
like I
you.
said, Carry Implant and General Dentistry, and we'll see you guys soon. Have a good one.
Yeah, thanks so much for having me. Yeah, thank you.